So
Okay.
I am thrilled to be joined today by Lori Dine, a familiar face for many of you who've seen our videos before. Lori with Mercy Health and Dr. Patel. Thank you so much both for being here today. We've got a really fun topic to cover.
Thank you
Thank
for having us.
Yeah, absolutely. So Lori, we'll start with you. We are coming up on, I believe Dr. Patel said this is the 15th recognized World Cancer Day.
Sure, yeah. So there are many well-deserved and significant days of recognition in the cancer world. We have Cancer Survivors Day, which is expanded into Cancer Survivors Month of June. And then most cancer types have their respective awareness months. But World Cancer Day is held annually on February 4th, and it is an international day of recognition for bringing attention to the work being done to reduce the global impact of cancer in regard to preventable cancer deaths and education, and then strides made in innovation in treatments like the ones that Dr. Patel does in radiation oncology.
Yeah, Dr. Patel, you play a really amazing role in a lot of people's lives here locally, but I want to talk to you a little bit more about what's going on in radiation oncology and what you've seen in advancements that hopefully give some people watching a little bit of hope.
Yeah, of course. So, as you know, radiation oncology is a critical component in cancer care. There's three tools, usually surgical, medical, and radiation oncology that play a role in treating patients. And over the years, the biggest advance in radiation oncology is that actually we're treating less and less patients. What we're doing is we're actually advancing our technologies so that we're able to treat patients in shorter times, shorter treatments, and with less radiation, while being more precise, more targeted, and being more able to cure patients with better treatments over these advances. Specifically, over the last 30 years, we've seen a 30% decline in patient death rates from cancer, which is attributed to not just radiation, but also the advances in medical oncology and surgical oncology.
Are you having those conversations with your patients who are newly diagnosed? Do they know that their journey may be different than what it would have looked like 30 years ago?
Definitely. A lot of patients come in with some preconceived notions from stories that they may have heard or seen online. And, I have to kind of remind them that their care is individualized to their diagnosis, and no two patients are the same. And everybody has a different, unique outcome based on their own path. And what we remind them is that each day there's more and more advances in cancer care, and our technologies now are more advanced than they were in the past. And they'll continue to advance in the future, and hoping that the care that we're giving now will be outdated in 10 years and patients will have even better care in 10 years.
Yeah, the Victory Center has a library of resources that we like to offer to anyone who comes in and has questions and interest. And we have to go through that really regularly and make sure that what we're offering is up to date, because there are so many frequent changes happening. And I think that's the wonderful thing about it.
Yeah.
What do you hope to see in the next couple of years of radiation oncology?
What I hope to see is, as we're getting more aware with our precision in cancer treatments, we're hoping to combine better modalities with our medical oncology counterparts and surgical oncology counterparts to figure out what is the best way to treat some of these cancers. And is the radiation we're giving helpful? Is it better to give more? Is it better to give less? And how can we preserve some of the normal organ functions around these tumors so that there's less long-term side effects? And as you were mentioning, the benefit of having the Victory Center is that we really do recommend our patients come to the Victory Center to connect with other patients that have gone through treatments, so that they can see that, even though you may have a hard journey going through treatment, there is a light at the end of that path, and you will come out feeling better and doing better. And, seeing some patients that have gone through that kind of reassures a lot of our patients.
Yeah, that's certainly our hope. Absolutely. You're well spoken. You're someone who I think a lot of folks can learn from, and you have something really exciting coming up. Lori, can you tell me more about this oncology symposium?
Sure. Well, we're thrilled to be reconvening a week to the day after the fashion show at the same location, the Hilton Garden Inn in Perrysburg. Our oncology program is hosting a symposium called The Impact of Precision Medicine in Oncology. And to Dr. Patel's point, it will highlight components of the program like medical oncology, radiation oncology, and surgical oncology, and ancillary services. So like our nurse navigators and things like that. So we can really highlight the multidisciplinary approach to care, which is really critical in cancer treatment and survivorship. And I think it's really fascinating. Before I came into working in the oncology world, I thought people went and maybe got a second opinion, which is, very valuable at times, because they saw one doctor and that one doctor made a course of treatment for them and they wanted to see what another doctor saw. Well, then I came to learn that in this multidisciplinary approach that your physician is actually conferring with their colleagues in various aspects of the oncology world to discuss your case and determine the best course of treatment for your unique cancer type and, to develop your prognosis and treatment plan. So I think that's interesting. And that's something that we'll see on stage at the symposium. So anyone in the professional world who would like to earn some continuing education credit, or even just anyone in the general public who's interested in coming to check out what's going on and advancements and the treatments that we have going on in our cancer centers. That does take place on Friday, March 10th. And I think, let's see, I guess a phone number that I could give.
Sure.
Yeah, you know what? I don't have the phone number handy, but we can post it right on the comments or the email if anybody would like
Share it
additional
with me
information.
after we're done with the recording. I will put it in the description of our YouTube video today.
Perfect. Okay, thank you.
Yeah, Dr. Patel, I'd love you to weigh in on that a little bit too. If a lot of folks will get information based on the medical world from pop culture, and things that they may see on TV and whatnot. You guys are such jack of all trades. You're not just someone who's focused on science and math or spreadsheets and this, but you have to be social and communicative. You're creating relationships, not just with your patients, but with this team of doctors that are working towards the same goal.
Yeah, I think, the basis of all of that is communication. We try to have open communication with our patients so that they have realistic expectations of their care, but also feel comfortable asking questions, and open communication with the other treating providers. As you mentioned, we have multidisciplinary weekly cancer conferences where we review patient cases, and we have radiology, pathology, we have surgeons, medical oncologists, myself, and radiation oncology, as well as our ancillary staff that all meet and convene so that everyone has an understanding of who is going to be walking in through the door, and so that we all have a united plan of approach that's based on guidelines. So we're also doing what's evidence-based, and that we're all agreeing that this is the best course of treatment for this patient. So that when the patient comes in and they say this to us when they see us, that, I've been to this doctor and that doctor, and all of you have said the same thing. You've said it in different ways, which is reassuring that you all believe in that path as being, the best, plan for me. And it kind of helps them understand that, all of us are also talking about them, but also, understanding of their situation and coming up with a plan that we really think is the best for them. And as Lori mentioned, we welcome patients getting a second opinion, and we also are open to suggestions from our colleagues at the universities nearby. If they have patients they want treated a certain way, we're open to it. But we also do have our own clinical trials that we do enroll patients into here as well locally. So it's a good way for patients to also be advancing cancer care.
Yeah, Lori and I actually talked professionally a little bit about clinical trials. And what's amazing, I think, is there are some patients right now who are creating strides for someone in the future. What a selfless act, to truly think this may not work for me, or this may not be advanced enough for me, but I'm going to do this to help someone in the future. It's really beautiful.
Mm-hmm.
Yeah, it's really empowering because that the experimental trial you're signing up for, you may not know which arm you're in, but that the knowledge that's gained from that trial may one day change the prognosis and treatment of a patient in the future. And really that's where we are now. The advances we've had over these last 20-30 years has come on the advances that patients made participating in clinical trials around the world that have helped develop treatments that are more targeted, more precise, and better at creating outcomes that are favorable for cancers all across the board.
So we know you're not shy about public speaking, right? Symposium coming up in about a month. How do you feel about walking the runway at the Luncheon and Fashion Show?
Excited. I came to the fashion show last year and I was amazed by all the fashion and the fanfare, and I can't wait to put on some of my sparkling shoes and get on the
Do you really have sparkling
roller.
shoes?
No, but I'm hoping I can find some at Diller.
Oh my gosh.
To go with the
Yes.
theme.
Yeah.
Yes,
We're
we are
so
glamorous
excited.
and glitter this year. So I think there's going to be
Yeah.
a little bit of sparkle everywhere you go.
Yeah. I'm looking forward to it.
I'm
We're
so excited that we sponsor this event every year because it is so fun. I love it. And it's, oh my gosh, you run the gamut of emotions at this at the event. It's a blast. You go from shedding tears over the inspiring stories of the cancer survivors, and then like cracking up and hooting and hollering over the men walking the runway, and it's just a blast. I'm very much looking forward to it.
Yeah, and certainly not to downplay your involvement. Mercy Health is our presenting sponsor of this event. We really couldn't do it without you guys. It's something that we look forward to working with you on every year, and having the support of someone like you guys in the community really validates what we're doing at the Victory Center. This is an incredibly inspirational event, but at its core, it's a fundraiser so that we can continue to promise people that they don't have to go through this alone, and that we can take every single dollar earned from something like this fashion show and give it back to the people who need it the most. So it's a huge honor to work with you guys. Dr. Patel, wonderful to talk to you today, and can't wait to see what you're wearing up on that 72-foot runway.
See you there as well.
Awesome.
Thank you so much, you guys.
Thank
Thank you.
you.